What is GERD?
Gerd, also known as gastroesophageal reflux disease, also known as acid reflux or heartburn, is the most common disorder of the esophagus. It is marked by regurgitation of gastric contents into the esophagus. GERD is due to a weak lower esophageal sphincter and intra-abdominal pressure.
How can I tell if I have GERD?
Well, it is felt as pain or burning in the retrosternal area and may radiate to the throat and the back. It usually occurs after meals late in the day or as a result of high-fat meals. It is also common during pregnancy in women.
What are some of the other symptoms of GERD?
While some of the other symptoms include pyrosis, dyspepsia, regurgitation, dysphagia, hypersalivation, and esophagitis.
I don't even know what that means.
No one knows what it means, but it's provocative. No, it's not. It gets the people going.
What are some irritating factors of GERD?
Well, some irritating factors include foods such as foods high in fats, chocolate, caffeine, and coffees. Also, taking medications such as nitrates for chest pain and beta blockers can also irritate your GERD. And gastric distension, which is caused by large meals, can also be a contributing factor. Smoking cigarettes is also another factor.
Oompa, oompa, doompa-dee-doo-dee. I've got a perfect puzzle for you.
What can I do to relieve GERD at home?
Well, it is helpful to sit in a recumbent position, which means sitting upright. Also, when going to bed, it will help to keep your head above your feet. You can do this by raising the head of your bed 6 to 8 inches.
What are some medications I can take?
Well, you can take antacids to neutralize the acid in the stomach and provide temporary relief. You can also use a proton pump inhibitor, such as Prilosec, which is most common and does not require a referral from the GI specialist. You can also use H2 receptor antagonists, such as Pepcid and Zantac.
Spoonful of sugar helps the medicine go down. The medicine go down. Medicine go down.
Is there any way I can avoid GERD besides taking medications?
Yes, there are a few simple ways to avoid GERD. Do not lie down after eating meals. Avoid bending over after eating meals. Weight reduction will also help reduce the side effects of GERD. Avoid aggravating foods, like fatty foods and coffee and caffeines, as mentioned before. Sleep with the head of the bed elevated, and
How can you diagnose my GERD?
well, you can have an endoscopy done, a barium swallow, you can have pH level monitoring, as well as a manometry studies.
What is the nurse going to do for me when I come in with GERD?
Well, first, the nurse is going to ask about your prescription medications. She's also going to ask what you've had to eat in the last 24 hours. The next thing he or she may do is try and relieve your pain and provide education.
So it's the same thing as peptic ulcer disease?
That's not true! So get your facts straight.